My first COVID story for The Star was on March 11th, 2020. Since then, I've written dozens of stories about COVID, but until recently, I hadn't gone inside a hospital. In early May, I spent a day in Brampton Civic Hospital with my colleague, Steve Russell, who took these stunning photos. We were only there for 8 or so hours, just a glimpse, but it was still powerful to see for myself what I'd been reporting on for so many months. The process of donning PPE, the cards sent to cheer on healthcare workers, the sheer number of medicines needed to keep COVID patients alive, a sign on a room signaling the patient inside was dying. For me, it was also powerful to hear directly from staff about what it's been like to work in this hard-hit hospital, the people who care for patients day in and day out. In the ICU, I met critical care nurse Darsh Takar. I had spoken to her back in 2020 and early April. The story was about ICU staff connecting critically ill and dying patients with families by phone or video because of visitor restrictions. For that story, Darsh explained how she'd put a cell phone beside a patient's head and a family member would say things like, "Daddy, wake up. Daddy, come home." She was the first healthcare worker I cried with in the pandemic, and it's an interview I'll never forget. I'm glad I could meet her and her colleagues in person and help tell just a little bit of their stories.